Beta HCG is a pregnancy hormone that is produced when the embryo has implanted inside the womb. It begins producing this hormone to alert all the organs in the body that there is a pregnancy, so that the organs can make preparations. All organs contribute to the pregnancy, and the beta HCG in the blood goes to all cells of the body and gives them the signal that there is a pregnancy, so that they are transforming. For example, the lungs are increasing their capacity, the heart also, the brain works different, and the brain is the organ that gives the orders to the tissues. All organs, the kidneys work different more, the liver will be working more. And how we do detect the beta HCG level? The indirect detection is in the urine. After a certain level, when there is a beta HCG above a certain level, the beta HCG goes also into the urine and is detectable with conventional urine pregnancy tests. These tests nowadays work also because they are getting very sensitive from day to day. They work also when there is no missed period. These are called the early pregnancy tests. And the other method is the direct method of measuring beta HCG level in the blood. And this beta HCG is usually detectable after 10 to 12 days after the fertilization has occurred. And the beta HCG level, as a rule, must increase over time. In 3 days intervals, it usually doubles, but there are also exceptions for this. For the pregnancy to be seen on ultrasound, using vaginal ultrasound, the level of beta HCG in the blood must be usually 1000 to 1500. To be seen on abdominal ultrasound, I talk about only the gestational sac, only the tiny gestational sac, to rule out the ectopic pregnancy. On abdominal ultrasound, it's visible after about 5000. After the level has reached 5000. Normally, we do not use beta HCG measurements so often, but if there is an IVF pregnancy, we make the measurements earlier and make serial measurements, especially if there is a suspected ectopic pregnancy. It's sometimes useful to make serial measurements to detect the ectopic pregnancy early, so that it's treatable with only medications such as methotrexate, so to avoid a surgical treatment.